Mr. Chairman, at the appropriate point, whether it be during questions or thereafter, I do have an Oklahoma citizen here, Mr. Sandy Chow, who is a native Oklahoman, constituent, as it turns out, of Senator Sykes, who would like to address the committee and talk about, I believe it's his wife's case, and how the caps that are proposed in this legislation might affect Oklahomans, if you would allow that to occur.
Okay, Senator Lasser, for this meeting, we're going to limit discussion to the members of the committee. If you would like to reiterate someone's story, you feel free to do that either during a question or in the form of debate. But for this meeting, we're just going to limit to members of the actual committee for questions or any discussions. Follow up?
Well, Mr. Chairman, let me ask you this. Is that going to be the rule just for this meeting because of the subject matter that we're facing today, or contrary to at least the last 8 years that I know of, having been on this committee, are we going to deny the citizens of Oklahoma the right to come in and speak to their legislators at a committee hearing for the rest of the year?
Senator Lasser, I would have to confer with the actual committee chairman on how the rest of the year is going to be conducted. I'm just knowing that chairing this committee, because the chairman is actually the author of these bills, that it is my policy that public is not going to be allowed to debate bills in an actual Senate committee. And if you would like to have them visit with us, there's plenty of time for them to do that in our offices or anywhere they would like. But actual consideration of these bills, it's for the members of this committee to debate, it's for the members of this committee to vote on, and that's what I'm limiting it to.
Thank you for allowing me the opportunity to speak. Thank you for demonstrating that there is a little bit of bipartisanship, knowing that a Republican contested the opportunity for me not to speak. I just wanted to come here when I heard about the law that was being passed, wanted to share with you my story in an effort to help you understand what this law could potentially do to the citizens of Oklahoma. My wife and I was born and raised in Oklahoma. My wife has been here since she was 18. She's now 55. We're homeowners. We pay our taxes. We're by and far, I would say, very good citizens of our fair state. She was diagnosed with cervical cancer back in August of 2009, and the way that it happened was that she had done everything that every medical professional ever prescribed in terms of prevention, getting her well woman checks every year, breast exams, the pap smears year in and year out. And because the pap smear that they used was essentially a cheap and outdated version, and I believe it was misdiagnosed and misread. By the time that we discovered the cancer, it was a stage 3B/4. And when I did some research on that, the survival rates for people at that stage of cervical cancer are very slim. And so as I think about the limit on the pain and suffering portion of what we've gone through for the last 18 months and what we're going to go through for the next, the doctors have said that the recovery time is going to be so long from her chemo and radiation that they're not even able to give us a timetable. Because the cancer had spread, was already at stage 3B, they were not able to go in and eradicate the tumor, but they had to do surgery, remove lymph nodes, and now she has lymphedema for the rest of her life. And for those of you who don't understand, lymphedema is in her left leg, and it comes and goes, and it impacts the quality of not only her life but our life. And we have 5 kids and 4 grandchildren among us. And so as I think about this bill, and you want to say that you want to limit the pain and suffering that we're going through, as I was thinking about last night, there's only 2 words that can even come close to describing how I feel. And it's, this bill, in my opinion, is appalling, and if it passes, it's unconscionable. I just don't understand how people can sit around and place a value on quality of life and pain and suffering. as I think about the judicial process that we have in place in our country and our state, juries are able to determine whether someone should live or die, but yet they're not qualified to determine the amount of money someone should get from pain and suffering. How do we arbitrarily place a value on every individual's pain and suffering? As Senator Sykes alluded to, he's going to consider it case by case whether he allows someone to speak. Why can't we allow a jury to consider case by case what amount someone should be rewarded for their pain and suffering, as every individual case is going to be unique and different? Some people will have less pain and suffering, some people have more. $250,000 as a blanket coverage is just, again, it's unconscionable. And from my understanding, this bill is to allow the state of Oklahoma to be competitive against some of the other states out there. I don't care about quantity of doctors, I care about quality of health care. And if there's not something in place that acts as an incentive to ensure that doctors are prescribing the proper medical care and taking the correct medical procedures, a $400,000 limit, if I'm a doctor, I'm going to do an awfully good job of making sure that I'm taking care of my patient. For $150,000 less, I just wonder what kind of incentive that's going to serve. And then if we limit pain and suffering, I think about my wife, she's on complete disability because of her leg. Chances are she'll never be able to work again. She was prepared to work for another 10, 15, 20 years even. And, and she's not able to work, guess who that's going to fall on? It's going to fall on the taxpayers of Oklahoma. And so, I don't know how anybody could sit around and arbitrarily assign a figure to pain and suffering, since it's unique and individual on a case-by-case basis. And if a jury is capable of determining whether someone should live or die, how is it that they're not capable and qualified to determine what amount an individual should receive for their pain and suffering? So thank you again for allowing me to speak. I appreciate it.
Mr. Chow, I appreciate you being here today. I appreciate the words that you had to say, and I think you've got a very powerful statement. Most of what you said I agreed with. If I wrote these down, and you don't have a way of correcting me, but I think that what I heard you say is that we, the legislature, can't place a value on pain and suffering. And I think that's absolutely right, Mr. Chairman.
But the point is that the legislature, sitting up here in the Capitol in Oklahoma City on any certain day, and not knowing a thing about a case or the facts of the case, should not be the one to limit by that determination that non-economic damages cannot exceed this $250,000 arbitrary figure that's drawn. So this bill, and if it is enacted, places more power in the legislature than it does in juries, in our citizens that sit and listen to each case. And that, I think, is the point.
So what we're telling the people of the state of Oklahoma, if you are injured in an accident through no fault of your own by a negligent driver, say you lose both legs, then you're telling the people of Oklahoma that you can still go do your job, you can still work, you can still carry on your everyday affairs, but you've lost your legs. So what you're telling the people of the state of Oklahoma, it's okay to just give you $250,000 for non-economic damages versus the $400,000.
This bill does change it from 400 to 250.
Follow up, Brandon.
That's the message that you want to send to your constituents, my constituents, and the people of the state of Oklahoma, that we don't think that your non-economic damages should exceed $250,000.
Senator, it'll be a colder day than today before I let you put words in my mouth as any what kind of message is being sent here, okay? The bill says what the bill says. You've obviously read it and looked at it. If you want to send a message, you go right ahead. You can send out any message you want to.
I've got several reservations and rising timid support based on a few things. One would be caps. As a conservative, caps concern me. So what we're saying is we can decide over a jury or a trier of fact what is a right number. Now, My wife is a stay-at-home mom. She does not create an income in the family. So she's at home, she takes care of the kids. Without her, I would probably die. I'm just going to admit that right now, and hopefully she's listening to this at some point. Without her, I would die, because I owe her a Valentine's present, and I'm probably not going to get it in time. So I want her to listen to this. Without her, I would probably die. Now, she is the force of the family. Now, to say that she has no economic impact. So non-economic, if a situation occurred, would be the only way that we could compensate from any kind of damage occurred to her. And that scares me to think that this body, no offense to this body, would place a value on my wife's life. That does scare me. I think that I like just basically reading page 5, line 20, when it talks about an exception, that a jury or a judge can find exception to that. However, the burden of this exception is so high. Clear and convincing evidence that the party which caused the damage were grossly negligent, or that it was committed with malice. It just scares me to think that we would limit a life, and I guess as a conservative, I've got to agree with my senators across the way here that we make the burden too high. And I say I rise in timid support because I do like the bill.
You know, we've heard pros and cons on this, and we've got a lot of bills to do today, and these are all very important bills. And I think the comments that have been made on both sides are very valid and need to be really analyzed. But when we really analyze it and look at what we've done at the end of the day, who have we benefited? You know, we're here elected by the people of the state of Oklahoma to help the people of the state of Oklahoma. And what this does, this flies right in the face of the people of the state of Oklahoma. We're sitting up here as a know-all, master of everything, saying, John Q. citizens of the state of Oklahoma, you know, if you get hurt by somebody's negligence, your non-economic damages, we think that we know enough that you just need $250,000, up to $250,000. You know, you always talk about family values. Where's your family values on this bill? They're going out the window. This is not helping the families of the state of Oklahoma. Who's it helping? The insurance companies. Let's just tell it like it is. Huge force in the state of Oklahoma. We don't have evidence here today. Senator Sykes says there's no way to track it, but you know darn well if there's runaway jury verdicts in the state of Oklahoma, he had it up here to tell us about it. He'd say all the different jury verdicts, runaway verdicts that gave $400,000 non-economic damages. We don't have runaway jury verdicts in the state of Oklahoma. That's why we're so red, we're so conservative. We don't do that. If you're really voting for your constituents, you'll vote no.
Aye. Senator Easton McIntyre?
No.
Senator Laster?
No.
Senator LeBlanc? No. Senator Nichols? Aye. Senator Shorty? Aye. Senator Johnson?
Aye.
Senator Sykes?
Aye.
Senator Schultz? Aye. 7 ayes, 3 nays.
Thank you. Senator Sykes, Senate Bill 863, having received a majority of the votes cast, will be passed out of committee with a recommendation of due pass.